is what I need. Less of me, and more is what I need. Show me more. Show me your power. Less of me and more. Less of me and more. What I need. So many times I strayed away, rejecting the love you want to embrace. But I realize I need you more and more each day. I need you more. Oh, I want you more. I want your glory. Less of me and more of you. Show me your power. Show me your power. That was I Need Your Glory, Ernest Pugh. I'm going to play it again Monday for y'all when we back to our regular selves. I can act up a little bit on Monday. We got to keep our composure. We got the police on the phone today. So on Monday, I'll play I Need Your Glory again. That's Ernest Pugh. Go check it out if you haven't heard that song. That one is dynamite. So we have a full audience, a full panel, I should say, for you today. And I'm going to introduce them before I go into the numbers. We have Anthony Ambrose, who's the Director of Public Safety, on with us. Darnell Henry, who's our Police Chief. Lakeisha Uri, who is the Director of Office of Violence Prevention and Trauma Recovery, new office. We have the 1st Precinct Captain, Captain Brown, 2nd Precinct Captain LaRue, 3rd Precinct Captain Costa. In the 4th Precinct, we have Acting Captain Carvalho. In the 5th Precinct, we have Captain Spencer is there. 6th Precinct, Acting Captain Wright Johnson. Captain Douglas, I believe, will be on for today. The 7th Precinct, we have Captain Robles, Deputy Chief Brian O'Hara, Acting Captain Tawana Rollins, Acting Captain Sharonda Morris. Phoenix in the house, Acting Captain Richard Casal, and Andrea Mason, our very own Andrea Mason from the Newark People's Assembly, will serve as the moderator of today. So let me get right into the numbers so we can jump right into this conversation. Today, in Newark, we have 8 more positive cases today than we did yesterday, which brings our total number to 438 since we started counting again on June 30th. June 30th, 2020, we have 8 more cases today, which brings us to 438. We have 1 more death today than we did yesterday, right? New Jersey has 184,061 cases, which is 360 more than yesterday, and 14,000 or so deaths, which is 11 more than yesterday. Now, we're going to get a zip codes, but I want to tell you something. Newark and the state of New Jersey have been calculating numbers 2 different ways, right? And I want to explain that to you because we're going to start giving you both numbers so you can have perspectives. Both numbers are right. We just calculate in 2 different things. The state calculates what we call case positivity only, right? And so what happens is, test positivity only. And what that means is that they only count the person 1 time. If you take several tests, they only count you once. And daily, they give a daily test positivity rate. So it's based on the test and not the patient. It's based on the actual test. So if you test 20 times, they only count you once. And that's how the state does it, and that's how they got their number. That's how the state comes to that number, and their number is high. Newark doesn't count you just 1 time. Obviously, we count every time you go and take a test, we count you. So some people have taken the test 7 times, 8 times, 9 times, 10 times. Every time you go and take that test in Newark, we count you. We count you as a part of our positive or as a part of our negative. We count you, right? So if you was positive once and then you take it again and you positive, if you're negative again, we count you. And the reason you do it that way is so you can understand the burden or the heaviness that the disease is having on a specific population. The specific population is us here in Newark. We get to determine how it is actually affecting us in this city and how well we're doing with it in our neighborhoods and our communities. The state's test positive counts each person just once, right? And that is useful when you're trying to actually do the community surveillance, when you're trying to track the virus, when you're just trying to see where it's going. You're trying to see if it's more prevalent in one place versus the other, right? We throughout the state, we're doing it based on historical data here in the city of Newark. So let me try to break it down more simply for you. So if 100 people were tested for COVID-19 and 10 of the 100 of those people tested positive, the case positivity rate would be 10%. Case positivity rate would be 10%. This is useful so we can understand the overall percent of people tested who tested positive. That's what we do. So now if one of those 10 people tested positive, goes back for another test, excuse me, that's what the state does. If one of those people go back, if 10 people got tested, if one of those go back and get tested again, this time they test negative, does that case positivity change? No, because the person already had COVID-19 and already got infected in the 10% a month ago. So we count them still. We count them more than once. And that's what we do in Newark. And it gives us in our mind, a clear picture of what's going on in the city. So let me go over what the zip codes look like. The last time we were here, we were at 2.8% in 07101. They are now at 2.9%. 07102 was at 4.6%. 07102 is at 9.6%. Some people went up and some people went down. 6.3% was at 07103. Now they're at 7.1%. 07104 was at 9.1%. Now they're at 7.6%. 07104 went down to 7.6%. Good for you guys. 07105 was at 10.9%. Now they're at 10%. 07106 was at 8.8%. And now they're at 7.1%. 07107 was at 9.2%. Now they're at 8.1%. 07108 is at 5.6%. Was at 5.6%. Now they're at 6.3%. 07112 was at 6.9% and is now at 9.1%. My area code. 07114 was at 10.9%, is now down to 7.3%. It gives us an overall, last time we checked, we were at a 7.6% total rate, case, well, I should say person positivity rate, and now we're at a 7.2%. We were at 7.6, now we're at 7.2. So we are going back down a small amount, but we're going back down, and we need to continue that. And so let me just if we did it based on the way the state does it, and I know everybody's gonna throw stuff at me. So the state does the test positivity rate. They follow the test and not the people. We follow the people, the state follows the test, right? We follow the people, the state follows the test. According to the state, their number is at 1.95%, right? 1.95. Remember, we were under 1, but now we're almost at 2, so we're at 1.95%. If we did our test, if we calculated our numbers the same way the state calculates their numbers, we would be at 1.85%. That means if we count everybody just one time and that's it, and not them going back and taking the test over and over and over and over again, that's what we would be. According to, and we're working with a group called Partners in Health and Rutgers Global Institute to really look at these numbers. And actually, the 1.85% is an increase of where we were. If we did the state numbers, we would actually below 1%. Now we're up close to the state. Now we're up at 1.85% if we just do the test. That's equivalent to us if we follow those people. Being at 7.2%. I wanted to give you both of those numbers to keep you in perspective so you can understand how we looking at this, how we studying it. But in each case, we went up. In each case, whether it's the test positivity or the case positivity, we went up. So either we following people or we following the test, we still increased, which is why we still have to take measures to make sure the numbers go back down. I'm going to continue giving the case positivity at 7.2% because I'm following you. I'm not just following the test, I'm following you at 7.2%. I'm going to continue to give that, but I'm also going to give you the perspective so we can compare to how we doing against the rest of the state and how the state is doing, right? So if we're at 7.2% following the people, if the state followed the people, their number would be higher than ours here in the city of Newark for the most part. So that's where we are. Let me jump right into these the things. And we're going to talk more about that on Monday. So write your questions down. I know you got a zillion and one. We're going to talk more about it on Monday. We're going to jump right into this public safety piece. And I'm in this order, I'm going to let Director Ambrose talk a little bit about public safety, about 2 or 3 minutes. Chief Henry follow up doing the same. And then Lakeisha Yuri can close out and talk about the Office of Violence Prevention and Trauma Recovery, some of the work that they do and some of the work that they anticipate doing. And then we're going to jump right into these questions. So without further ado, Director Ambrose, excuse me.
Good evening. Thank you, Mayor, for putting this forum together. Thanks for the opportunity to come before you and to the residents of the city. First, let me begin by saying just a brief overview on our crime year to date, that we do have 11% reduction from last year at the same time. Year to date, that equates to about 400 less crime victims. Our homicides, our shootings, our all crime categories are down with just a 2% increase in auto theft. We see a spike in auto theft, not major, but if we don't get on it, it can become major. Policing during COVID times, it was kind of rough because we had 180 police officers that were out with COVID. Not only did we lose 658 residents, Newark residents, but we also lost 4 members of the police department. So that was a tough time. After rebounding in May, then it was the homicide of George Floyd, which brought some protest into the city. And I have to say that for the residents of the city, when they tried to overtake our precinct, our first precinct on May 30th, and then on that Monday, on June, I believe it was June 2nd, that the police could not do it alone. The residents did an excellent job helping, and I want to put a shout out to the residents for helping. I have to say that we did see a spike in shootings in I shouldn't say shootings, but homicides in July. We had 5 more homicides than we had last year in July. They were mainly up in the Valesburg section. They're actively being investigated. There are targets on at least 3 of them that we know. The young lady was the last person to lose her life at Bradley Court. We met with the prosecutor's office today on that. We've confiscated over 240 guns year to date off the street. We also see an upkick in juvenile crime, mainly stolen cars and with violence. So during COVID times, we had some tough times, and I attribute some of these spikes because of the enormous amount of people having parties. We can tell you at least 4 shootings occurred that led from house parties. At least 2 homicides were because of large gatherings. So that's where we are right now. We also were stuck with, people were out of work, unemployment. There's other social ills that created this also. But I have to say that the police commanders in all precincts, we had ComStat every Thursday through our phone, through conference. We're back hybrid doing it, not only by phone, but we're also meeting now at 311 Washington every Thursday. So that's where we're at. I think that this is summer here. We look at June, July, and August. This summer here, believe it or not, even with the uptick in violence, this is one of the lowest summers in homicides so far. Since June, we had 11 people killed, where in 2014 and 15, we had 28 and 29 people lost their lives on that time. Shootings, what we're seeing is we're less shootings, but we have multiple victims. What we're seeing is people doing drive-bys, shooting at crowds. It's like we talk about some of these house gatherings that come robust to shooting into a crowd and you're shooting 4 or 5 people at a time, grazing them, and that counts. So our incidents are down, but our victims are up. That's what the spike is. That's all I have to really. That's a very brief overview of public safety. And I just want to say one other thing. I want to welcome some of our new commanders. We've had about 10 commanders retire. Since then, there was acting positions, there was promotions for captains, and some of the acting captains are on this forum here. And acting Captain Wright at the 6th Precinct, she may be late. She had an appointment. But we also have acting Captain Rollins from our consent decree unit. We have acting Captain Sharonda Morris from our Office of Professional Responsibility. And we have Deputy Chief Brian O'Hara, acting Deputy Chief, who oversees internal affairs, consent decree, and also community affairs. Thank you.
Chief Henry.
Good evening, everyone. I'm Chief Darnell Henry of the North Police Division. I want to thank the Mayor Baraka for hosting this live Zoom, combating violence amid COVID-19. Also to the forum for the hard work you do each and every day, and to the viewers and listeners out there. As Chief Police, I'm responsible for the day-to-day operations of the Police Division. I just want to thank you for inviting me to be here today.
Okay, Keisha, Yuri.
Good evening, everyone. Thank you for having me on this call today. My name is Lakeisha Yuri. I'm currently the director for the Shani Baraka Women's Resource Center, but now also the director for the Office of Violence Prevention and Trauma Recovery that will be opening very, very soon. This is a very innovative idea being brought forth, by the mayor, but also with people and our activists who are in the streets always pushing for Office of Violence Prevention. And now we have an opportunity to open it and to do this office. So the Office of Violence Prevention will be at the 1st Precinct on 17th Avenue. And in this Office of Violence Prevention, we're going to have a museum that's going to highlight the work and the endeavors that the police have had over time and how we've gone from policing to community policing. We're also going to have all of the violence prevention officers, a liaison stationed there that's going to be able to provide resources and services to people who've been victims of violence and crime, all under one umbrella with partnership, collaboration, and coordination. We find that all of these things need to be coordinated and people working in silos. So we're really trying to coordinate these strategies in a real way. We're going to have an anti-racism office out of here where people will be able to report being stereotyped or feeling like they are being offended by race hate groups and things like that. So we're going to have a space for people to be able to report these crimes. Under the Office of Violence Prevention, we're going to have a think tank, right? We just talked about this, where nationally people will be able to come together to come up with strategies on how we're going to combat this violence. So this office is going to be a community-based place where we're going to strategize. So we're going to bring together public safety and public health. We know that we need both entities to be able to intervene, to prevent and treat violence and crime in the city of Newark. Violence and crime happens in the community. It's happening in the community, by the community, and so it's going to take a community-based approach to be able to combat this. So this Office of Violence Prevention is going to be open very soon. We're projecting probably in the next one month or 2 months, we're going to have a sign on the door, probably in the next week or two. And we're really going to be strategizing to do a different approach to violence and crime in the city. Although there's an uptick in crime and violence, and the police director said we're at a low, the perception of the community is different. And so we're going to be really taking in that perception that the community has, because the community is feeling like, oh my God, violence is up. Oh my God, there's so many shootings taking place. Oh my God, what's going on? So we really have to take that into consideration, and we're going to have outreach workers, social workers, navigators in the community, really, really getting a pulse on what's going on in the community. And we're going to work from a community-based strategy to combat crime and violence through this Office of Violence Prevention.
Thank you, Keisha. That was great. And that's important too, because that adds, what you say, a perception adds to stress, right? And people feel stressed, and folks who feel like there's violence may think they need to protect themselves from violence, so they're walking around with weapons and all kinds of craziness. And so I want to get into some of these questions that are here. First, I want to, on my Facebook Live yesterday, somebody put up there whether they were serious or not. Some of our regulars jumped on a person, but they asked, because of what's going on around the country, were our police officers on strike too? And I told them our police officers never went on strike. That they worked then, and they still working during that time. I guess they're talking about what's happening around the country, and they're attributing that to spikes, because people are saying that spikes have happened around the country because the police have been laying down all over the country and not doing what they're supposed to do. Anybody can address that if you want to.
I think I said it the best, Mayor, is that, and I'll give somebody else a shot at this, but our uptick is multiple victims. So we're down in incidents, but we're seeing more people that are getting shot at an incident. So I could talk for, that's why our shootings were up in July. That's our only uptick that we had. Also on our homicides, we had 5 more homicides last month, and they were targeted assassinations that happened up in Valesburg. That were people that were targeted that I cannot speak about because they're open investigations right now, but we're closing in on a few of them to make arrests on them. So our officers are working. Matter of fact, our crime is down. Our arrests for the last 3 years are down, and our crime is down. So we're not arresting our way out of this. We're just not arresting any old body. We're arresting the worst of the worst, the people that are creating problems out here. So I think the problem here is our uptick is that it's multiple victims. That's what we're seeing. Our officers are doing their job out there each and every day.
Anybody else want to jump in? You know what? And I stole Andrea's job too, by the way. So I'm just gonna. That was my last question. I'm gonna allow Andrea to jump in here. I just saw. I'm gonna shut my mouth and allow Andrea to carry us from this point on. If nobody else wants to respond to that.
Yeah, Mayor, I had one thing I wanted to add in. As far as the slight uptick we have in stolen autos, we could use a lot of help from the people that are on this forum listening to us right now. Is we're seeing a lot of people leaving their cars running. The heat, it's hot outside again. They're leaving their vehicles running in their driveways unlocked. They're leaving them outside of businesses to go get their breakfast or their lunch. And people are walking by, crime opportunity. They're jumping into vehicles and taking off with them. So we could use a lot of help if we get people just to turn their cars off, lock their doors of their cars. That would be a great help. And that'd probably help us a lot with getting this number back down to where we need it to be.
Your show, Andrea.
Thank you, Mayor. It's always acceptable for you to steal my thunder. So everybody, thank you for joining in. And I implore you to please continue to share this on your Facebook, share the Zoom link. We are on for at least another half hour. Do a watch party, because the information that you'll hear this evening is going to be beneficial and it's critical for all residents of the city of Newark. So there are quite a few questions already in the queue. I also want to just make 2 quick announcements. If you are viewing on Facebook Live, put your questions in the feed and they'll be filtered over to me via Zoom. And if you are viewing via Zoom, please put your questions in the Q&A forum so that they come to me again. And I appreciate my team who's filtering the questions over to me. So the first question, which is a nice general start, is what can we do about people not wearing masks?
Well, we can tell them to put it on. We're talking about, we've been getting a lot of complaints from my Facebook crew about police officers. I mean, every single day we get complaints every time I get on about police officers not wearing their masks. And it almost seems like I'm beating these people up every day about putting on a mask. And, people actually look at police officers as leadership in the community. So when they don't have on a mask, it sets a tone for folks in the neighborhood. But we need to encourage people to wear masks. We're not writing tickets or summonses. But we need to encourage people to put their masks on.
Who counts the crime and how's the crime verified?
Right. We have a UCR, Uniform Crime Reporting Unit. that works out of 22 Franklin Street. They record the crime. Supervisors first see it, then it goes to them. Then the state police comes in and audits us, and then it goes to the FBI, and they review it.
Right. So we're just not making the numbers up off the top of our head.
How long is that typical process?
The process within, it could happen within 14 days until it gets to entered into the UCR process.
Thank you. Where are the guns coming from, and how are we monitoring those who have been using them?
Well, and can make the chief, but I'll just say that most of our guns come from the south and the west part, down south and west of here in Pennsylvania. That's where most of them are. We recovered 240 of them year to date off the street. We saw 38 of them were in the hands of juveniles so far this year, illegal guns. Again, we have a very robust partnership with the federal government, U.S. Attorney's Office, the FBI, Prosecutor's Office, State Police. Some of our major people that are toting guns and trafficking guns here. Last year alone, we took down 3 individual investigations with the ATF, who investigates weapons. So we're seeing actually our violence is going down, and we're seeing less guns taken off the street. So this year we have 240. Last year at the same time we had about 260, 263. But that's our strategy.
And just to add to the directors, last week, within a week, we recovered probably 14 to 15 guns in 1 week. Our officers took guns off the street.
Now, regarding juveniles, and you stated that there were about 38 juveniles who were in possession of guns. How do we handle that? Are they prosecuted as adults, or do they usually see the youth house? How do we handle juveniles?
Well, we started to jump on. So they're all arrested. There's a process with the juvenile where we have to notify an intake officer at the county, and they either say yay or nay. They go in or they come out. Most juveniles with in possession of weapons, they are put in for at least 24 hours, and then they go before the judge, and the judge decides if they're going to stay in or they're going to come back out. They do give a lot of juveniles bracelets to wear. A lot of things we're finding out now, the juveniles cut the bracelets off, or they wait for the battery to go dead before they recharge it. When the battery's dead, they go out of the house. Just this week, we've had a person that did a shooting in the South Ward, had a bracelet, left the house because it was dead, then went back and charged it and said he was home all the time. So, and we have evidence that he wasn't. So your answer is, yeah, we prosecute, and the prosecutor's office and the judges, be quite candid, they're a little lenient more on juveniles, the judges, and we've had juveniles arrested 3-4 times for shootings and homicides. Finally, when they do a homicide, then they keep them in.
So I want to say that we also have community-based solutions, community court that we use in the city of Newark, and that's usually for things that are not violent, that are not like gun charges or homicides or shootings. There's an opportunity for young people that we have in Newark and not in many other places to go before a community court of folks of his peers, where the judge is a young person, the jury is young people, to begin to try to steer them away from a pathway of violence and crime that does exist in the city of Newark. And so if you know young people that are engaged in different things, you need to begin to try to figure out how to get them involved in that program.
Also, I want to add to that we have a robust station house adjustment. That there's a lot of kids that make a mistake, like as the mayor said, that we do a station house adjustment. We probably lead the county in that, even though we are the largest municipality. But that was something that never went on. But any minor offenses, rather than putting them into the criminal justice system, we give them a station house adjustment.
So why is the response time so low Right, my apologies. Why is the response time so slow when someone reports or calls 911 or just the 6,000 number?
Well, on 911, we track that hourly. 911's answered immediately. You remember back 6 years ago, there was 17,000 calls that weren't being answered. We're going to Jersey City, so that's corrected. Our 6,000 number, they answer. All our assignments are prioritized. And you know, when you call the police, everybody wants the police car there right then and there. We only have limited amount of police officers, so we have to prioritize them. So if people call in a drug complaint, it's a priority 4 or priority 5. So domestic violence is in front of that, or a person with a gun's in front of that, or a burglary is in front of that. So they're all prioritized, and that's how we dispatch, basically.
And is it possible for a resident to check on how many shootings there's been in the city or within a certain time frame? Is that information public?
Yes, transparent, right on our website. They can go on there and get our crime numbers. It's very transparent. They could look at our stops, and they could look at all our crime per precinct and per city, for the whole city and per precinct.
What's the website, Ambrose?
NorcPublicSafety.org.
Okay, now this question, I didn't have an opportunity to read it in its entirety, but I know it is the sentiment of quite a few people just from what I encounter handling Newark People's Assembly. So it says, is it possible to have a private sit down with the mayor or anyone to converse about high drug traffic and gangs that congregate each day on a specific block? I've been reaching out for the last 3 years, blah, blah, blah. So particular people have insight on what's going on. So is it possible that person can give that information to somebody to really make something happen? And what way should he or she go about doing it?
I would say that they can call my office, 733-6007. They can email me, ambrosea@ci.norc.nj.us. It will be kept confidential. We also have Crime Stoppers they can call, but if they want a more personal, call an appointment, we could have the right people that handle gangs and drugs and the commander from that precinct. We could have them all there and have a meeting. We could do it conference, or we could do it in person with PPEs.
Can they talk to any of these captains? Are any of you going to give up some information? What if I'm in your ward, in your neighborhood?
Just to add to also, Mayor, all calls will be kept confidential, and the calls could be, anonymous.
Can he call any of you captains? What if I live in the 5th precinct or the 3rd or the 2nd? Is it possible for me to get in touch with one of the captains to have a conversation about what's going on in my neighborhood?
Absolutely, Mayor. We're also on the website too. There's a link underneath our photo in our precinct. They can click on there and send us an email. Our phone number is also on there. So any information they want to pass over, if they want to meet with us, they can just send us an email or call the office. The numbers are all there. We'd be more than happy to meet with them.
What I will add is an email seems a lot less personal, and if I'm giving confidential information, in my mind, it's not going to be confidential because it's in writing. I think a one-on-one or a phone call is more comforting than sending an email.
Yeah, the phone numbers are listed there also, so they can absolutely call.
That's correct, Mr. Mayor. I give out my cards when I do the community meetings and the walks that I do on Saturdays with the Hansberry and Maple group. And I've also been up on Clinton Avenue, Marin Place. I've met with several people in the time that I've been on. So yes, I'll try to make myself available to the people. And Councilman James has my number. He gives my number out to the people I get calls from, and I try to service them as fast as I can.
So regarding the consent decree, have we found that the training has changed officers, and do they have to maintain annual physical fitness guidelines? And does the training include cultural sensitivity?
Yes, thank you. In regard to the training for the consent decree, all of our officers have received the required training that the consent decree requires. The last piece of the training that began earlier this year is the implicit bias training. That was the final piece of the 40 hours mandatory training that we're implementing every year for all Newark police officers. That began, we suspended it in March. We just reinstated it again this week. So now officers are coming again to the 7th precinct where we hold the training every week. It's fewer numbers of officers so that we can social distance, and they all come with PPE on, but we've reinstated that training now. We've been able to do that. In terms of following up with the training, I think that's the thing that we keep hearing all the time from folks in the community. They want to make sure that after all this effort, after all the community meetings we had, after all these policies, literally hundreds of pages of policies that were issued, and all the training, all the money that's been spent to have this training and to put forth all this efforts, people want to make sure that this stuff is real, right? So, they want to make sure that officers' behavior actually changes. So what we do every day, what Captain Rollins does with her unit and the consent decree unit, is following up on all the body-worn camera videos that we have. We follow up on, critical incidents that occur. We review police reports every day. And what we're trying to ensure is that the change is made real, right? So that we identify any gaps that might exist in the policy or in the training, and right away we take action to fix it. And that's something that's ongoing. It happens literally every day. We'll review incidents where, that there's a high potential of risk, right? There's a high potential for something to go wrong. If an officer is assaulted, if an officer uses force, if officers respond to, some of these large gatherings and stuff, we want to make sure that, the officers are actually following the policies that the director in chief have put in place, and making sure that they've done everything to de-escalate situations, try and prevent incidents from occurring. And when we do identify a gap or identify a training need, we take action right away. The person is referred to our training division, and we follow up to ensure that in the future, the behavior is corrected and the problem is resolved.
Thank you so much for the response. Is there a correlation between COVID-19 and crime? Anyone want to take it?
I can answer, but I want to defer to one of the captains to answer that, or the chief.
Well, as far as I'm sorry,
yes, we have there's a meaning I can't directly say. However, COVID-19 cases rose, crime have risen. Our statistics don't show that, but we are showing a decrease in nearly every crime category. What we did notice is a spike in juvenile crime, and also people being released due to COVID early from correctional facilities, and also the large parties that we've been responding to. We're seeing a crime increase and spike up due to that.
I'd like to add to that. Chief?
Right.
So I think the difference in the beginning, we were quarantined, so there were a lot of people inside, a lot of people staying home, so the crime was less. So I think it's changing. Some of the spikes are happening because a lot of people are now hanging outside. They allowed some parties, so now we're seeing a little bit more violence, shootings from large gatherings that happen. So I think it's fluid, so it's changing.
Yeah, I also like to add that a lot of our domestic violence crimes have went up during the pandemic because I guess everyone's still home.
And we find that the burglaries went down because people were home. So because everyone was home during that time, but now that they're going back to work, it's the opportunity for the people that do walk the blocks and see people leaving, going to work, to take advantage of it. But there's not a large number right now, but we do see a small problem maybe arising. Like I said, it's not a major problem. People are just going back to work slowly, but we do see it coming.
And I've observed with the juvenile crime rising slightly. The children, they're not in school. They're out all day wandering around. So we've had a slight uptick in juvenile crime. Nothing major, some criminal mischief stuff, the issues like that coming up, but
So,
that's just
so
because they're out of school all day.
let me respond to that, what Costa just said, because, you know, when the superintendent makes a decision, if he goes virtual, you're gonna be responsible for keeping your kids in the house from 9 to 4, 8:30 to 4 during school time. If they're outside, Truist is gonna pick them up. I'm telling you, you're gonna be responsible. The kid, we expect them to be engaged in educational activity, even if we gotta take them to a place and make them get on a computer ourselves. But we do not want to see an uptick in juvenile crime because kids are out here roaming up and down the street. We do not want to see that, and we do not want to have any issues around these young people. So we're counting on you to be responsible for what's happening. I'm going to put Lakeisha and some of the office violence folks on helping us with that during this time period as well.
Thanks, Mayor. So there are quite a few more questions. So I also see that there's some kudos for Captain Spencer and a lot more for Captain Douglas. And there's, Captain Douglas. And the Q&A states, we, the Ivy Hill neighborhood community, were very disappointed that Captain Lee Douglas from the 6th precinct is being moved. So they want that to be known, and they don't appreciate it. They also want to know, what is the Newark Police Department going to do to address the officers' mental health and break down the barrier of stigmas within the department as it plays a factor into how an officer interacts with the community?
That's a great question. That's a great question.
I'm gonna ask one of the captains or some of the captains to answer that, and then I'll join in.
Not everybody at one time, y'all.
Right.
Well, I know the police department offers the officers cop to cop, and we have different programs through our unions that assist us and can get us assistance if we need it. As far as the stigmatism, we all know going through COVID, I had it, there was a problem. We've come together, and there's very little stigmatism now. If you need help, you ask for it. The director's been very strong in supporting his people, and he's been one of the people that called me constantly and made sure I was okay, and he checked on all of us every Sunday. It was a call. Are you okay? What do you need? What can we do? He let us know that the department was behind us and let us go through what we need to go through, and if we needed help, we could ask for it.
Also, there's a resiliency program that the director put out, and it's based on the Attorney General guidelines that every agency in New Jersey has to have a resiliency policy for their officers pertaining to officers asking for help and seeking counseling or employee assistance.
Anyone else want to chime in?
Keisha, you have any opinion on that?
On which part? I'm sorry.
On mental health of officers?
I certainly have an opinion on the mental health of officers, and certainly would like for that to be addressed in a way, because I know that we have a trauma to trust training that the officers go to with Equal Justice USA, so that they can learn about trauma and start to address their own traumas and identify their own traumas in relationship to the work that they do. Many of them go from job to job to job to job with shootings and stabbings and carjackings, and they see so much stuff, but there's no time for them to take a break. They go from, work to work to work. So I certainly think that the mental health needs to be addressed. Their social health, their emotional health need to be addressed, but I know that there's some stigma attached to mental health, and that if you are deemed, crazy, or you're deemed, that you have an issue, then your job can be at stake or something can be put on your record. And so I think that we should find a way within the department for them to be able to get self-care and get their mental health addressed in a way that it stays safe within the department, but it does not create an issue for the community and how they do their work. So I think there needs to be a well-being office created within the police department, so that the people who are in the police department who have degrees in psychology, who have degrees in criminal justice, or whatever degrees that officers have, that a committee is created within the police department to be able to address mental health and to make sure that well-being and mental health is addressed within the police department.
Like that a lot.
100%.
Yeah, that was good. Thanks for that, Keisha.
And one thing, we do have, for critical incidents, we do have something in place where if an officer is involved in a critical incident, we do have, the officer goes to Rutgers University, to the hospital, and does get a chance to speak to a professional at the hospital. So we do have something in place for critical incidents when they occur.
So there's some questions around defunding the police. So can someone explain, or a few people talk about what it means to defund the police, and has the morale changed within the police department since this conversation has been brewing?
That's a great question.
I think as head of the agency, I will start it, and I'll ask captains and deputy chief to jump in, and don't be shy. But I would say when the mayor announced diverting some funds from the police budget to the violence prevention office, I was in favor of it, and I spoke to the commanding officers at ComStat at length. So let me explain that most of our work in policing, you're a social worker. I call it a guardian versus warrior. Most of our times we're guardians. So I would say about 20 to 22% of our workload deals with mental health, people with addiction, domestic violence. Not all the time domestic violence rises to a police response. So taking 20% of our workload and having social workers and people that are trained in different fields, I'm a proponent of that. And it can be a hybrid where they respond to certain situations that won't escalate if the police go, possibly. So I think this can be a model. I said it all along. I told the mayor that. I think as far as morale, I think what we went through with COVID, what we went through with as far as monetary losses of people not paying taxes, or they're out of work and paying, that the mayor had no layoffs, no demotions. Okay, he continued to give us the needs that we needed in the department to work. As far as morale, he just authorized the promotions of some people on this forum, plus 27 sergeants as acting sergeants to be promoted. So when it comes to morale versus defunding the police, I think that word defunding, it isn't defunding, it's diverting, and it's not doing away with police. It's attrition. If 150 police officers retire, so it's some of that money going diverted towards social workers. So I'm all for that, and I think that will work, and we can be a model. And any other captain or deputy chief wants to jump in?
I was in, sir. So as far as defunding the police, it's diverting that money. Some of the community events that we do, that money goes to those events. If it's a barbecue in Bradley Court, or shutting down the block, letting the kids play. So we can divert that money towards those events. So it's not getting rid of the police, it's diverting the money and using it for a good cause.
And I'll just add, just reallocating the funds for those that social service that was mentioned will give an opportunity for the police to do more proactive policing versus reacting to crimes that occur.
I think the key to, in the beginning, people hear the word defund, and I don't think the police officers understood. So I think our job as the captain is to explain that diverting the money to social services is actually a positive thing. It will actually help the police officers, like the director said, will give us time to work on other issues in the city, quality of life issues. So I think it's a positive thing. I think it's our jobs as captains to explain it to the troops. And I think the morale, I think in the beginning they were a little taken aback by it, didn't really understand it. But I think once you explained it to the officers, they understand it, and everybody's behind it.
And another part of that is under the Violence Prevention Office with, reallocating the funds, is that we have several programs and organizations that already exist that have gaps and needs for programming that they can't afford to, provide funding for. And so this Office of Violence Prevention is going to certainly be helpful. And as we look at social workers being in the police departments to be able to help to do some of the lower level response work. It's going to be helpful for the police department to be able to respond to the more critical calls. And a lot of things are quality of life. And so if you have people who are, social services, social workers, or people who can respond, that's going to be more helpful. Many people are still traumatized by the police. People still are afraid of the police. Some people want to see more police, and some people would like for someone else to respond. And so we can have both. The Shani Baraka Center will be under the Office of Violence Prevention for domestic violence and sexual assault, and we'll be able to fund a lot of the programming that we wasn't able to do in the past. We have the Hub, we have North Anti-Violence Coalition, we have North Community Street Team, we have My Brother's Keeper for mentorship, we have Equal Justice USA, North Street Academy. So we have a plethora of programs and organizations that's already in existence, but constantly fighting to find funding of how they're going to, fund their programs every year. And we have to pull a rabbit out of the hat, and that shouldn't be. And so in most police departments, in most cities, the police department has the biggest budget. And so if we can just reallocate money from those bigger budgets to help people who have no budget, a non-existent budget, but they're out there doing the work with no budget, then I think that it's a win-win for everybody. So the community is at the center of all of this. And so this funding and allocation really needs to be with the community in mind. The funding is going to be 75% of it is going to be for programming and for, programming and resources for the community. So it's not going to be top heavy with salaries and people getting paid, all of the salary money. 75% of this money is going to be for programming so that the community can see a lot of this trickle down to see some outcomes and results.
Awesome, that's great news. Thank you. You're gonna have to repeat that a few more times, not necessarily in this forum, but specifically to me, write it up so I can send it to the community, because that's some great information. So we have about a little over 5 minutes left, and I want to try to get to as many more questions as I can. Regarding curfew, what specifically is Newark's curfew? Is it being enforced, and what are the consequences when a juvenile is caught after, during the time that they're not supposed to be out?
Yeah, well, what we've done we created a new initiative, and it's been going for a couple of years now, where curfew for juveniles is actually 11 o'clock. What we've done, which we had real success in, instead of bringing them to the juvenile facility, we've actually been taking them home to their parents and bringing them to their attention that their kids is out, past curfew, or and actually save lives. Saves lives out here, because if they out here, they could possibly become a victim. So we have great success in doing that, and that's what we're going to continue to do.
So what's the age? And you mentioned a lot of times we think about the evening time. So 11 p.m. to what time in the a.m.? Well,
the age of it is 17 years old. If you're not accompanied with an adult, whether you're going back and forth, maybe you're going home with an adult, that is great. And it's 6 a.m., from 11 to 6 a.m.
Thank you. And so the West Ward the Upper Vailsburg, I should say, is demanding an answer regarding Captain Douglas's move. Can anybody comment on that? Is that a sidebar?
No, I mean, we don't talk about personnel issues, but I will say this, that Captain Douglas, who was the first captain assigned to that precinct when Mayor opened it up 2 years ago, he was going to retire. He put his papers in to take terminal leave and retire. And then he had a change of heart, and we already assigned Captain right there. So it wouldn't be right, and that's the decision I made, it wouldn't be right to move Captain right from that precinct. So Captain Douglas will have his hands up there yet. He's also doing some transitioning with Captain Spencer in the 5th precinct. So we're gonna get our money's worth out of him.
Yeah, I want to say too that and I know the captain feeling good today. The people, but Captain Douglas is a part of the police department. He's with us. He's going to help us everywhere he can, wherever we need him at. He's going to be there. He's always been a soldier for us, so we appreciate the work that he did in the West. We might need him in the South. We might need him in the North. We might need him various places. He has a great future with the department, and we hopefully, we can use him as many places as we can. And, Ivy Hill get a little selfish up there. Maybe you should say something to these people, Captain Douglas.
Hey, Mayor, before you start to speak, I just want to say, to all fairness to Acting Captain Loma Wright, I just asked for the community in the six precinct to just give her a shot, right? Give her a chance to and just see what she can do. And we're monitoring it. We put people in places not to let them fail. So we behind them 150%, just like we were behind Douglas when he was up there. And like the director said, unfortunately, we had to make a decision. It was a tough decision to make, but we still have to run the police department here, and we can't, worry about when people put their paperwork in. We got to look and see what the next person, the next man, the next female, they up. So and that was a part of our decision. But Captain Douglas is a part of us. He's going to always be a part of this family here, the North Police family, and we're going to utilize him we're going to bring out potential in him that he probably don't see yet.
Chief, can I add something to that? So right now, I'm still working with Loma Wright. She couldn't make it tonight. She had prior engagement, but I'm still working with her, and I'm also working in the 5th with Captain Spencer. So I plan on being here for a while. You guys will have me.
Good.
I appreciate that, Captain Douglas. I think they needed to hear your voice. So thank you for that. A couple more questions. Sit Still Sundays begins this Sunday. How does it affect church services?
Well, hopefully y'all not in church at 8 p.m. because we shutting the place down at 8 p.m. So unless we're having a long service, and some of y'all do. But everything is normal until 8 p.m. We shutting the city down. We just trying to, we really trying to gauge our numbers. And we have Partners in Health and Global Institute and other folks contact tracing, trying to figure out where these numbers are coming from. Why are we getting high? So we need people to sit down for a minute. We need you to stop doing what you've been doing, give us a chance to focus on trying to find where this virus is growing at and get our numbers back down. I read the numbers today. Us in comparison to the state, we're actually doing better than the state. If you went by their numbers, if you go how we compile the numbers up here, we're at 7.2, and that's way too high for us. We want to continue to go down, and we're going to do that. We're going to do that. I'm confident in that.
Mayor, what stores are able to stay open? People are asking about fast food restaurants, drive-throughs.
It's probably the drive-through owners that are on this call asking about it. But the supermarkets and the pharmacies are the places that stay open. At 8 o'clock, you have to close your place down. In terms of people driving through to get something there, we'll make a determination about that. I'll put something out about that. More than likely we may let you go through the drive-through, but some of you guys abuse it and let people inside the store. If we see you doing that, we're gonna close the store down altogether.
Okay, one more question. I'm gonna try to combine a few that may be related. Okay, so regarding crime within the neighborhood, how can citizens engage civically to help the police department to fight or combat crime? Yeah, that's it.
I would ask the captains, at least 2 captains, to answer that.
Okay, I'm new to the 5th, and I've met with several community associations, and that's the biggest thing. Community coming together, raising the children as we used to, as a group, getting to know your children, getting to know your neighbors, creating the associations, building the different associations that will meet with other associations and provide the service that we need to help you and you help us.
I like to piggyback off that, Captain Brown. I don't know if you can see me, but yeah, like the officers and we can't be everywhere all the time, so we need the community to engage us, to give us vital information in a safe manner, which will allow us to do our jobs more efficiently. So, their help is greatly appreciated.
Right. I would also like to add on that. Here at the police department, we have a slogan that the police are the community and the community are the police, and we rely on the community in order to get this job done. Everyone helps. It's just not us. We need everyone.
I just want to say that we have virtual cameras we put up like 3 years ago. And I think that it was made and designed so our citizens could become our true partners, and they could report crime to us without looking out the window or getting involved and becoming a victim themselves of retaliation. I think it's important that if you go on our website, or if you don't have a computer, I know everybody has a phone, that you go on northpolice.org and you can get onto our virtual system. You can monitor cameras in and around your neighborhood. You'd be surprised if you see the map. There's a lot of cameras. And you can call the police when you see something. If you see something, say something. We appreciate that. If like someone wants to meet personally with myself or the chief or the precinct commander that's on this phone, or internal affairs commander, I encourage you to call and meet with them. All calls and all information is kept confidential. Our internal affairs is not in a police facility. It's down at 493 Broad Street. I ask you to, if it's an internal affairs issue, crime issues, call your precinct commanders. If you don't want to go to a facility, meet somewhere, and your name will be kept confidential, because that's one thing that is practiced in this department if you give us information. But I ask you to look at your cameras. Tonight, if you're listening, if you didn't know about it, go on our community virtual camera system and start monitoring and be our eyes and ears. A lot of police departments have cops monitoring the cameras. We have you monitoring our cameras because we want you to be a partner. And that's one way to build trust, that you get cameras with us.
Do you guys still get the district police councils?
I want to add also, when the captains have community, they have community meetings within their precincts, for all the residents to attend those meetings and voice your concerns. That's another way, we can address this issue together, come up with strategies, so we can deal with this here, deal with.
And just a comment for Ms. Keisha Yuri, there are qualified residents within the city of Newark that would like to volunteer or use their many talents to help with that Office of Violence Prevention. So how should one contact you if they have that expertise?
So I've been receiving a ton of requests from people who would like to work in the Office of Violence Prevention, thanks to the mayor and the chief of staff. And people have been dropping by the Shawnee Center, and I've been getting tons of resumes. But I put my email address in the chat on the Facebook Live. So my email address is there, but it's uriel@ci.newark.nj.us. And also, if you call over to the Shawnee Baraka Center, I'm there Monday through Friday, so they can call there, 973-757-7377. So we're welcoming all ideas for anyone who has ideas, for the office, but also the community knows the post and they know what's going on. And so we definitely welcome any input, people who would like to volunteer. We can look at some volunteerism. But please reach out to me and we can, schedule some time to sit down and just see what the input is.
So thank you everybody for joining us. Hopefully you gained a wealth of knowledge. I appreciate the mayor, director, chief, all of the captains, of course, Ms. Yuri, and my team that helped me moderate, filled in the questions to me. It was definitely very informative. Hopefully we'll do this again soon. Have a good night, everybody. And please be sure to tell everybody the 5 p.m. updates happen every day with the mayor, COVID live updates. So we need more people to join in, tune in to get this helpful information. Have a good night.
Okay, thank you.
Thank you.
Good night.